There you go. Good morning.
Good morning, everyone.
Good morning. Thank you so much for joining us. So much is going. Yeah, so much is going on in our community, and so much anticipated on the horizon with PUA payments expiring. People are still without jobs. The COVID numbers are rising. How is the Guam Behavioral Health and Wellness Center preparing for, I guess you could say, a surge of people, experiencing anxiety? Is that something that you guys are looking at?
Well, I can just say that the department is very concerned about the high surge, but it was anticipated. Mm-hmm. We knew human behavior. Once you relax things, there's also going to be more spreading because more of us are in enclosed areas without social distancing. The hope, I'm sure, I know that the governor was hoping, is that everyone was going to continue to do their part despite the opening. So even though restaurants and activities are at 100%, it was our hope that everyone will still continue to do their part. Whatever is happening, and I see it myself in the community. I go to stores, I go to restaurants, I go to gas stations. I'm very concerned that some businesses have taken the relaxing of allowing more people in to the relaxing of the preventive measures. Yeah. So, for example, I'm walking into business establishments who are no longer filling up the alcohol or the hand sanitation. I'm walking into certain businesses who are not, their temperature check is turned on. And because I'm part of the healthcare team, I'm very vocal about things. I when I stick my hand in and nothing comes out of a sprayer, I alert, hey, this is empty. Can you fill it up? Or where do I sign in? And then all of a sudden they open up the book. So we or the notebook for contact tracing. Mm-hmm. So I'm a bit concerned that some businesses are starting to hear the word relax and they're relaxing on the preventive measures. But that's really not the case. Everybody's expected to continue to do what they need to do. The only difference is that the number of people allowed is relaxed. So the department is already, it's not that we're going to get more. We have been busy. I can just say, just looking at the hotline numbers that was provided to me, the average number of calls in June was 823 calls in June. And so that is high. April was 620, May was 723, June is like tracking 820, was tracked at 823. So April, May, June was an increase. I don't have the July numbers, but my guess is, it'd be the same. And why? It's the same thing that we're going through. People are calling in for anxiety, depression, just information, concerns. We're not, I think we're going to continue to see the trend. If the question is, are we anticipating more calls or more business, if you will, in my department? We are busy, and I think it's just going to continue to trend. Now, with the double digits and lately, which is early August, I believe it's just going to be the same. You're going to see more people calling. I think we're going to average about 800. That's a high. But we're bracing ourselves for the continuous high level of numbers that we're already experiencing. But more importantly, we're bracing ourselves for what's going to happen when school starts. As you know, Guam Behavioral Health has a Children and Adolescents Division, And as school begins and more children become face to face, then a lot of things physically are recognized. Teachers and counselors will see things, and it is a natural thing that more referrals to CPS and to Guam Behavioral Health will happen. So we are bracing ourselves for the opening of the school year. However, the department has been very proactive. We wrote a grant to the governor's grant program, and I just, your call to come on, Chris, is so timely, because just Friday, I received the award notification that Guam Behavioral Health will receive $1.3 million to stand up the School Safe Guam mobile app. And that is something that I heard about in one of my first national conferences that several states are doing, and particularly Utah was very successful in implementing this Safe School app. And so we are really excited that it's so timely, and that the administration saw the application and the importance of applying something like this.
When is the
Safe School app is something where kids will be able to anonymously report suicide ideation, will anonymously report fighting, bullying. As you know, kids know everything. They know what's going on in their school. They know what's going on with their classmates, but they do not want to be a target, so they don't speak up. But we're looking forward to implementing the Safe School app, and I just want to thank the governor and lieutenant governor for having the faith in Guam Behavioral Health to implement this in conjunction with in partnership with DOE and the school and the 30,000 school students in their school system.
Well, that's wonderful news. When are you guys hoping to have that app ready to go?
Well, we got the notification, like I said, Friday, and we're going to look into immediately. I believe the money will be available as soon as possible. I'm just waiting to sign the agreement, which is going to happen this week, because it is a grant, and so I have some requirements through the state clearinghouse that I need to do some reporting to, like all grants do, to make sure that we're in compliance. And so we're looking at starting it immediately, and I just think it's very timely. And especially because suicide ideation among kids, you know, there's an adjustment period, right? So as the kids are concerned and of not seeing their classmates and having to have that adjustment issues, there's also a rollout of adjustments the other way. So it's not only that they're going to be in school face to face, but some kids, some of their friends may not opt to go face to face. And so there's that longing still of some kids not being able to see their friends. And even if they're in school, they have to adjust on how are they going to communicate and hang out, if you will, safely. So, you know, and those things could be frustrating. And so kids may get anxious and upset about those things as well. So, you know, there's an adjustment backwards and there's an adjustment forwards. We all have to just take things one step at a time, slowly but surely, and really just count our blessings in the end. You mentioned PUA. I know that one of the news is, you know, doing a countdown, right? The newspapers are doing countdowns, and there's a lot of requirements regarding PUA. And so, but, you know, all I can say is that Guam Behavioral Health is here. We have a crisis hotline. If you're feeling anxious about PUA ending, if you're feeling anxious about your family's financial condition or stability at the time because PUA is ending, or in the end, we're just here to serve anybody who wants to talk about any type of anxiety, whatever the cause of that anxiety may be, whether it's PUA or back to school or anything else, or working hard to find a job and maybe the industry is not open yet, and that anxiety. We're here. We're here to talk you through. There are safe ways to manage your anxiety and your depression. And if there's anything I can say to the people of Guam is that you're not alone. You're a phone call away, and it's 647-8833.
And that's why we wanted to get you on, Therese, because, we often hear about the Guam Memorial Hospital, the hospitalizations, they're low. But with the Guam Behavioral Health and Wellness Center, it's a completely different story with regard to the number of call-ins, the number of people that need help. And I just don't want anybody to forget, there is another impact, and it's the mental health impact of what the pandemic has done to our people. So thank you guys and everybody over there at the Crisis Hotline.
Thank you very much. I mean, I can't do this without the help of our media partners. So I really want to thank you and Chris for always reaching out and staying close to the department. We are, again, here to help anybody who's going through whatever anxiety and depression they may be going through. And so a lot of the calls that come through, some of them just need an immediate somebody to talk to, and they're okay. And a lot of them go through more intensive screening and actually become a consumer of ours. And all I can say is we're busy, but it's okay, because busy at the department means that I people are getting help. Mm-hmm. And so let that be my problem, to get more service providers. Mm-hmm. I think that's a good problem. Yeah. Honestly, I see that more of a challenge than anything.
Right. Teresa, I wanted to just close by asking about the vaccination mandate that came out by executive order Friday. Do you have offhand a number of employees that under your watch that haven't got it, and then what's your process moving forward?
Okay, thank you. I figured that would be something that we talk about this morning. We are at 283 staff, and about 52 of them are not vaccinated, and for various reasons. Some of them have medical conditions that we will not be forcing. But I personally am I'm constantly talking to staff and constantly meeting with managers. I have a meeting at 9:30 this morning with my managers about talking to their staff. We need to set the example as a healthcare agency, because I consider myself equal and part to the hospital and public health. We need to set the example, and whatever issues that people may be reluctant to receiving the vaccine, I need to make them comfortable enough to receive the vaccine. Now, what people forget, and I think it was reminded when the governor put out her video, is that government of Guam is the largest employer of the island. And so as an employer, we need to do what we need to do to make the people of Guam safe. And so I just want everyone to know that I will be meeting with the managers, and I will be talking to those employees who are not vaccinated. And Guam Behavioral Health actually is a vaccine hub. We are a vaccine hub for our consumers. So every Thursday, if you're a consumer of ours, you and your family are more than welcome to call our pharmacist and make an appointment and get a slot. But every Thursday, we vaccine our consumers, our staff, our families, our service providers, whoever is connected with us. We're trying to take away the strain from the other clinics, vaccine clinics. So it's going to be very easy for our 52 or less than 52, because there's some medical reasons that they can't be vaccinated, to be vaccinated. All they need to do is go to the second floor and get their shot. Now, employers having a mandate is not unusual. So I don't think we should think too much about it. If you're, many employers is doing what they need to do to ensure that their staff is vaccinated so business can continue. And I think that's really what this mandate's about, doing what we need to do so our business can continue. If the last thing I need is for my staff to be quarantined because somebody in my staff is ill and has exposed other service providers. Because what does that mean? That means then our consumers, the general public, the people of Guam, will not be served. So there's various reasons why I fully support it. And so we're opening our Thursday vaccine to our staff. And so I'm fully supportive of employers making the right choice and making sure that their business continues properly and safely.
Teresa's last question again. What disciplinary action would you consider for those people who are eligible to take the vaccine but just won't?
Well, we're going to have to go through that, right? I'm still reading into what exactly those procedures are. But really, if you're an employee of an agency or a business, for example, if KUAM mandated it, you have choices every day. I have a choice every day to either do what my employer asks me to do or not. So I'm very confident. I don't even know if I have to go to that disciplinary. I think there are reasons why people are apprehensive, and I think if there's just more conversation and education, that I don't believe that we're going to have to go through that disciplinary side. I'm just confident, in light of a lot of things, in light of people, not a lot of jobs out there, in light of, everyone has to decide, do I get a shot because I'm scared? But what are you scared about? There's no data that people have died from a vaccine, but there's data that people have died without it. So I believe it's just a little bit more education and maybe personal education.
Man, Teresa, I got to correct you there, because a couple weeks ago we did have someone who was fully vaccinated die on Guam of COVID. It was an elderly lady. I mean, she didn't die
that
from
has
the vaccine.
died, but with but that person had a comorbidity.
Right. Yeah.
Right. Yeah. So, in that respect, I stand corrected. But the realities is that people in the hospital who are gravely ill are those that are not vaccinated. And so, the data is the data. And if we're going to be an informed community, we need to follow the data, right? And so, again, the question you asked me was, what kind of disciplinary measures will I take?
Yeah.
And I'm not, I'll do what I need to do, but I'm confident that my staff will also do what they need to do. And with a little bit more education and compassion, we're going to be able to get those who can. Again, there's some who are medically cannot, and their doctors themselves are signing off that they should not receive the vaccine. Those people, of course, will be excused, of course. But if you're a healthy, able, young individual that just has concerns, and that's the reason why you're not getting vaccinated, then we're going to work through those concerns and convince you.
Thank you, Therese.
Yes.
Thanks, Therese.
Thank you so much. Be safe, everybody.
You too.
God bless.
Bless that.
Take care.
And again, the number for the crisis intervention hotline is 647-8833, 647-8833. 3. And we're going to continue on in the Zoom room where we're going to bring in representatives from the Guam Federation of Teachers. Please